Well, good afternoon. Thank you for coming to our first of what I hope is a long series of brown bag lunches talking about court entry and the Eastern Pennsylvania continuum of care. Today's series begins with a conversation around coordinated entry and working with domestic violence survivors. We're here, we have a great panel of experts here, and we're going to spend most of the time in the next hour answering your questions. And so be prepared to ask your questions using the chat feature or making comments, and I'll be monitoring and sharing those as we go along. But right at the beginning, I'm going to take the opportunity to introduce our speakers today. And then we just have a few questions up front to really set the stage for the conversation. So my name's Jason Alexander. I work with Capacity for Change, and we are I am the court entry consultant for the Eastern Pennsylvania CoC. And now I'm going to introduce you to each of our speakers, starting with Tara, and let them introduce themselves.
Hi, everyone. I'm Tara Day Ulrich. I am the programs director at Transitions of PA, and we're a victim service provider in Union, Snyder, and Northumberland counties.
Emily.
Hi, Emily Aubele. I am the Quality Assurance Director for PA 211.
Maria.
Hi, I'm Maria Williams. I'm the Director of Housing at the Pennsylvania Coalition Against Domestic Violence.
And Jackie.
Last but not least, I'm Jackie Condor. I serve as your coordinated entry regional manager for the Northern Tier. I'm also one of the Northern Tier RAB co-chairs and serve on your governing board for the Eastern CoC. And in prior work, I worked with what was formerly the Clayton County Women's Center here. So now is Roads to Peace, which I'm sure many people are familiar with.
Great, thank you, Jackie. So one thing you might notice if you know our four panelists or just thinking about the organizations they represent, we have two leaders representing the victim service providers that work in the Eastern Pennsylvania CoC region, as well as two leaders in our actual HUD CoC coordinated entry system. And the reason it's so important to have this conversation, and it's not the first we've had together, and I hope it will not be the last, is trying to make two different federally funded systems work together to best serve people that are fleeing domestic violence or domestic violence survivors. And, you know, admittedly, having helped to design the system and been a technical assistance provider ever since, it's not perfect. We're not perfect at it. So what we want to do today is really focus on some areas that are either confusion at the policy or practice level, as well as really start to share some of the maybe different interpretations and philosophies of how to best serve DV survivors, given that our providers have different levels of expertise, experience, and also in some cases responsibilities to meet either governing board set written standards and or more likely also kind of HUD standards that sometimes restrict our ability to do things the way that might be best for any given household. So we're not shying away from the fact that this is a challenging aspect of our work, but I think we're committed as a CoC to being a learning CoC. So this is an opportunity to do some of that learning and sharing and discovery. I would point out that Tara has already posted a file in the chat that you can download that I believe was handcrafted on supporting survivors, some do's and don'ts. So feel free to download and take a look at that. But I'm going to start with a question for each of our speakers and then move into an open discussion to answer your questions. And I'm going to ask Maria if you would be the first person to speak and talk a little bit about the philosophy of service and what a philosophy of service means in serving domestic violence survivors, and also in terms of facilitating coordinated entry as the front door into the housing resources that the HUD continuum of care can provide. So do you want to start us off, please?
Sure, thank you. Thanks everybody for being here today. As many of you know, talking about domestic violence and coordinated entry is literally my favorite thing to talk about, which makes me an incredibly boring person, but excited to be here today. So I'm really glad that there's this turnout. I also see many DV experts that are in attendance today. So as we're moving through this, please feel free to add, to chime in, to enhance the conversation in whatever way that you see fit, because Tara and I are here today to talk about what we know, but we know that that's just a small part of the puzzle. So thank you all for being here today. So Jason asked me to talk a little bit about philosophy of service, and I think this is a really great place to start from, because a colleague of mine many years ago told me a phrase that I say to myself often, and that is, your people are our people. And what that means is that domestic violence survivors are also people that are dealing with homelessness or being unhoused or housing instability, are also people that are dealing with mental health or substance use concerns, are also people that are dealing with extreme legal cases, are also people that are dealing, we could go on, right? So there's this idea that somehow domestic violence needs to be separate from everything else that's occurring within the homelessness coordinated entry system and CoC in general. But what we really want you to know is that if you are serving a homeless person, you are likely serving a survivor of domestic violence. So upwards of 80% of homeless female-headed households in the United States are also homeless, are also dealing with domestic violence. About 40% probably domestic violence was the direct cause of that, but that's probably underreported. So the majority of the people in the CoC that are seeking assistance are survivors of domestic violence. So your people are our people. And that is even more when we can look at the idea that the leading philosophy for the CoC, for the East, I would say, is the principle of housing first, which is the idea that there's no barriers to housing that we're putting in place, that it's a trauma-informed system, that it's client-centered. We just went through incredible trainings with C4 that really talked about that. And there were so many times that I just wanted to stand up in my living room and applaud, because I think that C4 has such a great way of talking about holistic services, which is what we want for everyone. These are the same things that we want for survivors of domestic violence. The main difference that you're going to see is that we're not going to insist that survivors give data and give information and give personally identifying information in the same way that other folks that are going through the system would, even though that we know the most client-centered trauma-informed system allows that freedom for any person in any household that's coming through the system. So I think that if we have a coordinated entry system that works well for survivors, those are some of the folks that are going to face the most barriers with getting into the housing resource that they really need. That system then is actually going to work better for everyone else, because we've fine-tuned it to the folks that are experiencing the most trauma and the most barriers and are often in the most need. So if we set that high bar, which we continue to try to do here in the East, and that all of you do every day in your individual programs, we're going to be able to really, I think, move to a place where we're combining philosophies, that it isn't the DV housing first philosophy, because we do have our own philosophy of service that we call DV housing first, but it's rooted specifically in the housing first philosophy. So it's all the same. We're going to talk a little bit about safety planning and that sort of thing today. And that's where I think the expertise is where things become a little different. So the philosophy of how we do the work is exactly the same. If you're serving people well, you're serving survivors well. But it's the specific sort of tricks of the trade that we know in the DV field take a lot of skills and a lot of expertise that we want to make sure you're able to partner with your local domestic violence provider to support you with, or for you all to get the training that you might need at your organization to do some of this work. I've talked with some of you, really, this is about building confidence. It's not that you're not already doing it. It's not that you're not doing it well, but what we want to make sure that you have is the confidence to be able to serve survivors well. So we need the confidence to serve survivors well within coordinated entry to make sure that they get the resources that they need, just like we need that for any other group that we would be working with. So Jason is always a big fan of the fact that I give non-answers to things, which I feel like this is a long non-answer, but there is nothing about this that is clear cut. It is nuanced, and it is shades of gray, and it is challenging, and everything has to be individualized. So there's no broad stroke, this is how you serve survivors of domestic violence that I can give you, any more so than you could look around the folks in your program and say, this is how all of them need to be served. So that highly individualized, highly tailored, unique, trauma-informed, client-centered service, that's our philosophy, that's your philosophy.
Great, Maria, thank you so much. So that's a great kind of a building block or cornerstone for the conversation. And so we want to move a little bit into how exactly we as a coordinated entry system try to meet some of the unique needs and opportunities we have to work with domestic violence survivors and people fleeing domestic violence. And Jackie, could you kind of share with us what are our strategies as a coordinated entry system?
Yes, I definitely can. So I just want to touch on something that Maria just shared, and that was building confidence in working with DV survivors. And I really like that as like a front runner for my section here, because I think that there's a lot of confidence building that comes into how our coordinated entry system is even developing that confidence, and it's a work with survivors. And so something that many people might not be aware of is that last year we had established a domestic violence task force, and actually all of your panelists and Jason were all members of that task force. And I feel like that task force was truly where our coordinated entry system was able to build that confidence in working with our survivors or those who were attempting to flee domestic violence. And we were able to establish some more appropriate means of serving those unique needs of those survivors through this task force. So some of the things that our coordinated entry system does is allows someone who is fleeing the ability to remain anonymous in the system. And that's a very difficult thing to navigate through initially when we're keeping information about a client in the system confidential and not identifying anything that would be PII, so your personal identifying information regarding that client. So at the front door, when someone's calling into our coordinated entry system, whether they're doing that actually through 211 or through a walk-in access site or by phone, given the pandemic, our access sites are answering by phone sometimes, but we have an opening script that we like to follow. And one of the questions immediately is to identify whether this person is someone who is in an unsafe situation. The vocabulary specifically is, are you currently living with or trying to leave an intimate partner who you are afraid of or who threatens you? And we use that as kind of the stepping stone to identifying where the conversation needs to go for that person who might be fleeing. And if they are fleeing, they respond yes. Our CE specialists offer a warm transfer to their local domestic violence hotline. So that is really the cornerstone of where we're beginning that safety planning piece. And now, of course, someone else will talk about the safety planning, but it's important to identify that that's something we do at the very beginning of that call. And then once we move into the actual assessment itself, whether they decide to get that transfer and call back into coordinated entry or decide to just take the number and continue their assessment within coordinated entry, we are giving them the option to remain anonymous through this assessment. And so some of the pieces that we are removing from our assessment for those who wish to remain anonymous are dates of birth, gender, ethnicity, race, family, household makeup, including size and individuals within it. And so those pieces are obviously very important when we're having providers reach out to clients. And so phone number is one of those things that we really are removing from the system entirely. In addition to allowing that consumer to create their own password. So it is very client-centered in how we're approaching anonymous records within coordinated entry. So those clients are choosing their own password to be identified as such in our system. We are not identifying anything for them. And now if we don't have a phone number to attach to a record, how are we keeping track of that information so that our coordinated entry system can actually serve those clients? We established what is called the Smart Sheet, which I'm sure you've maybe heard like through a rumor mill somewhere and aren't really entirely certain of what that actually is. The Smart Sheet is basically an Excel sheet that is a secured system that we keep track of HMIS ID numbers, DV anonymous client passwords, and their phone number. In addition to whether it's safe to call them, safe to identify yourself as the provider who is reaching out to them, whether you can leave a voicemail for that consumer, and if it's safe to text, because we do know that not all of our clients across the board, whether you're fleeing or not, sometimes don't always have access to a working phone, but maybe a text now number. And so we are keeping track of all of that information in Smart Sheet, and your regional managers and Emily at 211, as well as Patricia Espinosa Vargas at 211, have access to that Smart Sheet. And your regional managers are responsible for providing you that phone number via phone so that we're not sharing any confidential information through email about that client. So we really do try to establish many safety networks within our system that we're using to maintain the confidentiality that the client is hoping to have within our system. Our notes will be the last thing I touch on. If you are using coordinated or HMIS, I'm sorry, you know that we keep case notes, coordinated entry intake notes within the system regarding each client. Our domestic violence households, those who are fleeing domestic violence, I'm sorry, have much more restricted case notes. So we are very cautious in what it is that we're actually keeping track of in that case note. One, everything is always going to be related to their housing search. There's no need for us to be divulging in any information regarding that client's abuse in a case note. And then we're also making note of some of the things that I mentioned we keep track in for Smart Sheet, whether it's safe to call them, safe to leave a voicemail, so on and so forth. And what county they're in, because of course that would help us to determine where it is that they're needing services so that the appropriate providers can be reaching out to them. I think that's it. Oh, I'm sorry. I have one more thing. In our Smart Sheet, we also keep track of additional safety measures. So we're not necessarily adding those to case notes because that might be something that's identifying within a case note. You know, if a person who is fleeing knows someone who is working in this field and might have access to HMIS and our coordinated entry intake notes, a certain additional safety measure note within the system might be identifying to that person. So those are notes that we also keep in our Smart Sheet to continue maintaining the anonymity of that client and protecting their confidentiality and safety.
Great, thanks, Jackie. Appreciate that. And there may be you're welcome to ask some questions in our follow-up section, and certainly use the chat. I love that people are kind of posting who they are in the chat, so we're getting to know each other, but also please start thinking about the questions you'd like to ask of our experts. And so kind of building on what Jackie said, what our core entry system allows people to do is really get connected to subsidized housing programs, including rapid rehousing and permanent supportive housing, as well as direct connections to emergency services, which could include homeless prevention assistance, emergency shelter, transitional housing, street outreach, and other housing and homeless service programs. And so a lot of the people that are in this luncheon today and that work in our CoC member agencies, whether they're doing core entry intake as specialists, or they are case managers or other housing program staff, are interacting with DV survivors. And Tara, I was hoping you could answer the question, how should our core entry specialists and our referral partners really approach the concept of safety planning when they're working with people that are fleeing domestic violence?
For sure. I will say, just to kind of reiterate what Maria said at the beginning, this is not going to be safety planning in how DV providers do safety planning. That is very nuanced and very individualized. And frankly, if I sat here and told the CE specialists at 211 to do a full-on safety plan, I don't think Emily would be my friend anymore because it would take a long time. So, but what you can do all the time to really approach your work with DV and safety planning in mind, the first thing is just listen, believe, and validate the survivor. Just to really listen to what they're saying, not to ask questions that, even though you may not be asking them in a way that you mean them to feel like they're victim blaming or you don't believe them, but just, you know, asking questions only what you need, and validating their experience, understanding that, you know, not saying if a survivor tells you this story that seems so unrealistic to you because you've never had an experience like that, you're not saying things like, really, that are, you know, making the survivor think you don't believe them. So some examples, you know, I'm really sorry that you're going through this right now. You don't deserve, nobody deserves for something like this to happen. The other thing that we can do is, and that you can do is really, and we say this all the time in the DV world, let the survivor drive the bus. And you just remembering that the survivor can dictate what is safe and what is unsafe for them. And really just asking about that. Making sure that you're offering options. And it's okay if you're offering an option that isn't going to work for the survivor. The survivor will tell you that if that's not a possibility. And it's just, remember, it's not your job to decide how the survivor stays safe. It's your role to really generate ideas and think through different options. So thinking about, you know, saying things, what are some things you can do that can help you stay safe until a rapid rehousing provider is able to get in touch with you? And just offering ideas and choice and not prescriptions. So we want to make sure that we're not telling this or leading the survivor to think that everything's going to be okay if they just do this one thing, because everything likely won't be okay if they just do this one thing. And also the other part of that is we want to empower the survivor to make their own decision, which if we're just telling them what to do or telling them what they need can be very difficult for them. The next thing I wanted to talk a little bit was about sharing resources without judgment. You know, you may talk to someone who is fleeing, but maybe they, through the course of your conversation, they also disclose that they're struggling with substance use right now. You know, giving them that, you know, information for a substance use program can be done two very different ways. You know, hey, it's completely normal that, you know, people who are experiencing domestic violence use drugs and alcohol as a means of coping. If you ever decide that you want to talk to someone about that, I have numbers for you, and you can leave it at that. Now may not be the time that the survivor is able to think about that. But what we don't want to do is say things like, I think you might need this number for this drug and alcohol program, because that's making a judgment, even though we're not really trying to. And another thing that everyone can do is to support the survivor's right to autonomy. So we have to remember that when we say the survivor knows what's best with them, we kind of have to talk the talk and walk the walk with that. So if the survivor decides that what's best for them right now is staying in a living situation with their abuser, then we have to respect that choice that they made. And we may not like it, but that's when you have to, you know, use your support systems, use your coworkers, you know, call me. I talk through these kinds of things with my staff all the time, and I know it's frustrating, but we have to remember that the survivor knows what's best for them. You know, an example, we had a woman in our safe house one time, and her abuser would call our hotline and say, you tell her I'm going to kill her. And she wasn't fazed because she's like, oh no, he's just drunk, it's fine, he'll sober up and this won't be a problem. But for us, that's really scary, right? So we have to really let them dictate to a certain extent what is safe and what's not. On the flip side of the don'ts, things that we don't want to do is we don't want to try to be investigators. And I know that can be kind of tough because, you know, we want to know what the survivor situation is so that we can know how we can help them be safe, how we can get them connected to resources. But we also, you know, if it's a situation where they're coming into our emergency shelter or they're coming into our offices, we have to make sure that everybody else there is safe too, right? So we're trying to gather information, but just be mindful of the ways in which you're doing that. Sometimes when we're asking a lot of questions in a row, or if you're asking the survivor to repeat their story a lot of times, that can feel like an interrogation, or it can feel like we're not believing them. So just really being mindful of that and giving the survivor a break if they need a break. And lastly, you know, don't make assumptions. It's very easy to say, okay, I've worked with 25 survivors and I've given them all these referrals and I think that's just what all survivors need. And that's not necessarily the case. Every survivor may need something different. So we just want to make sure we're not making assumptions about one survivor based on our experience with a different survivor, because every situation is very, very different. And just the last note that I'll kind of leave on is, just as long as the conversations you're having with survivors are open, honest, and supportive, and you're willing to give them, you know, realistic options, then whatever safety planning you're able to do is going to be trauma informed, because that's really just the basis of it, is that open, honest, supportive communication.
Thank you so much, Tara. Appreciate that. And, you know, so in our court entry system, we have a call center, toll free, that's powered by 211, as well as over 20 walk-in or community-based access sites in different communities throughout the 33 county region and growing. We do have some partnerships with some of the domestic violence providers who are doing court entry intake offline, as you now have heard about, and then working with our regional managers to make sure that those survivors are accessible to housing providers in HMIS in a secure way. And we have about, at any given moment, 75% of our court entry intake work is done by our call center, and about 25% at any given moment is done by one of our access sites. And we now have 3 dedicated veteran serving access sites that are and are still in, you know, working with domestic violence survivors and people fleeing DV who are also former, you know, active or former active duty in the military. But I wanted to ask Emily, as really the coordinator of our 211 call center, who's responsible for those 75% of our intakes at any given moment, what are some of the challenges that our call centers, court entry specialists are encountering when you are attempting to do intake and referral with people that are fleeing domestic violence? And what are some of the strategies or solutions that you've figured out work better?
Great. Thanks, Jason. One of the things that, you know, we find is we right off the bat, when we ask the question that Jackie referenced, are you actively, you know, fleeing? We need to assess where that individual is right then at that moment and establish any protocols we need to establish for the remainder of that call. For example, if we get disconnected, is it okay to call you back at this number? So there's a number of different things that, once identified as fleeing or unsafe, we need to make sure we have those things in place so that in the event there is a termination of that contact, we are able to get back in touch as per that individual's instruction. Generally, if an individual identifies that they are right now in that moment feeling unsafe, we're going to make a warm transfer to a service provider. Sometimes that can be a challenge getting through, as with anything. There's a lot of angst related to getting this person connected to someone that can help them immediately, get them to a place where they are safe and then able to complete the intake and the assessment. I think some of the things that Tara mentioned, we work with pretty specifically in terms of collecting all the information we need to collect at that time to get the individual connected to the services that they need. There is the human element of trying to kind of be an investigator, collect information we think we need, but in really just the details that need to go in for the professionals to contact that individual. This is kind of like on the more, I guess, personal side when we talk about the challenges. As everyone here knows, those calls, those contacts, those discussions are difficult. And our specialists are really invested in ensuring that they are connecting these survivors to the services they need, but they may never know what happens. They may never know how that situation ends up for that person. So having the communication with all of the team members involved in that scenario is really helpful. I know that in the past, working with Kayla Gower, that was just monumentally helpful for our specialists because she was a constant resource, but also was able to provide some feedback as to, hey, Sarah, I just want to let you know this individual had housing. And that really allows the specialists to feel as if the work they're doing is making an impact. Having that resource available pretty, consistently is good for when we're in the middle of a call. And we use Teams quite a bit. And that is the way all the specialists who are not in the same location are able to kind of connect and support each other. So there's a lot of questions that we are able to have answered through that. And that person is also a part of that Teams environment. So we're able to really respond pretty quickly to concerns that are brought up. We do have a dedicated queue for those who are fleeing domestic violence, and that allows us to get to those calls more quickly. It's a matter of someone identifying and selecting that option, but we put that in place so we don't have people who are potentially in crisis waiting in what could be, as you all know, a very long line. Training is really, really important. In fact, we will be very shortly here setting up an in-person DV training for all of our specialists. Since 2020, all of our specialists are new, but one that has been here the entire 3 years. So we're going to be providing that training face-to-face in the same space. We did that with Kayla prior to COVID. Incredibly helpful, really good opportunity for people to ask questions and talk about some of those things that Tara mentioned related to how we approach our discussions and conversations with individuals, tone, word choice, all of that. So in the past year, obviously, being able to have, it's really important, I think, to be able to have that face-to-face time. It feels a little bit more private. It feels a little bit more personalized, and folks feel a little bit more comfortable asking questions that they're not sure if it's okay to ask or not about working with survivors. So those are some of the things that we encounter, some of the ways we try to address it. And of course, without all the help from the regional managers and the VSPs, it's just, you know, absolutely critical for us to have that kind of connection and that support.
Great, thank you, Emily. Appreciate that. I wanted to ask as we transition. So I'd love it if we'd love it if you posted any questions in the chat. This is the moment to ask them. There's no wrong question, and all of us can help answer them, including all of you in the audience. But while I'm waiting to get some of those questions in the chat, is there anything anyone who is one of our speakers, you know, heard from one of our other speakers that you kind of wanted to pick up on or build on?
I actually just had one thing I wanted to say in response. You know, Emily brought up the point that, you know, they hear these stories that, you know, people who are fleeing are saying, but they never know what happened to that person. Did that person, you know, get a resource or anything? And I mean, I just wanted to say that Emily, I think when we did our APR, we had helped 58 households just in one grant. So that's 58 of those DV survivors that your team, Emily, was able to get connected to resources, and those folks got housed. So I know the PCADV Rapid grant, it was the same kind of thing. You know, you guys, your work is showing in the number of survivors that are getting housed permanently.
The PCADV grant housed 78 households last year, and that was in the middle of a pandemic. So like the work that you all are doing is unparalleled, and it really deserves to be celebrated.
For sure.
My thought is actually just right in line with that, but also in line with really what my question was and how coordinated entry is serving those who are fleeing. So case notes in the system, I know for VSP, well, we all know that VSPs, you're not privy to using HMIS. And so sometimes we have those domestic violence providers who are a bit weary, I think is a good term, with sharing information regarding clients that you're working with in our system. But I can tell you truly that your regional managers who are entering those notes on your behalf are not divulging in any confidential information regarding that household. And in us being able to do that, sometimes our coordinated entry specialists at 211 level may happen to cross paths with that record again and see those case notes and know, okay, this person was housed. That makes me feel so much better. So case note entry is so important, and that's something that is also part of the unique way that CE is serving those who are fleeing domestic violence, because your regional managers are actively working with local VSPs in their region to communicate what's allowable, of course, based on whatever confidentiality agreements, and consent forms have been signed on their behalf to communicate with us. But we really are trying to assist these households with everything possible. And sometimes it includes those case notes and being able to identify when those households are being served and housed successfully. So all tied in.
Well, that's great. Thanks. We're getting some questions in the chat, and so I want to dive into those, and all of our speakers can work together to answer them. And I see that Maria is already addressing Julie's question about some resources, which is great. Let me raise a question as follows. How should DV providers respond if a known abuser is being referred from 211? Should we case manage with the regional manager about whether they are a DV victim or a DV abuser? That's the first part of the question, if you want to address that.
So I guess, Amanda, that would really depend on what are your agency's policies around, you know, if someone has been identified as an abuser for someone that you're working with, you know, what are your agency's policies around that? Because of course we don't want to serve someone's abuser if it will somehow cause harm to the survivor that we're already working with. But we also know that Someone can be an abuser in one situation and a victim in another situation. So I would say really casing internally would be the first step.
And as far as the conversations with your regional manager, I know we are all absolutely understanding if your response is, okay, I'll see, because we're totally aware of the confounds that you guys are obligated to. So if you're not sharing any information in that initial conversation, that's okay. We're probably going to get back to you because we want to know if you are going to work with them or not. And then, of course, then you could follow Tara's suggestion, talk about that internally, and then share whatever it is you're allowed to share with us. I know historically we've had some agencies that just say that that's a conflict and we're not able to serve them. And that's enough for us. Okay, let's move on. So
just so
whatever you
you
have to
all
do.
know, the conflict of interest policy is a real thing in the DV community here in Pennsylvania that is part of being a PCADV funded member program. And so the DV providers receive lots of training about conflict of interest. And what that means is that if you're serving a survivor and they tell you who their abusive partner is, you can't serve the abusive partner. It's kind of that simple, which is like a no-duh statement that has a lot of like legal junk wrapped up in it. But one of the things that I think when I'm doing technical assistance with many of you that I hear a lot about is assessing who's surviving and who's abusing, I think can be really, really challenging. And I just want you all to know that that's challenging for the DV community too. Like that's not just on you. So there will be some ongoing conversation about that across the Commonwealth in the upcoming year. But if you ever need to, if you're not sure what's going on, if you're serving a household or there's a household at coming in for the assessment with 211 and you're not sure what's going on, please call me, or I'm going to volunteer Tara. Please call Tara, and we can help you think through these things, because the worst thing that you can do is be confused and not talk about it. I mean, I think that's like kind of like a golden rule life lesson, but specifically when you're serving survivors, like if you don't know what's going on, it's okay. It's really hard and it's really confusing. And the more that you can like sort of shed light on it, discuss it with others, the better.
And there, so that I think what you were just talking about, Maria, ties into a part two of this question, which is if a known abuser is in our CoC system with a DV status, would their status be changed to non-DV? And it sounds like it's very situational, specific to a household. I don't know if Tara or Jackie, if you had any other ways to help answer that question.
I would just say no, it wouldn't automatically mean that that person is not fleeing DV themselves. I will say it makes it a little suspicious and I might take pause, but at the same time, like I said, there can be situations where someone is, it's very nuanced, that there's like layers of trauma and abuse and that kind of thing. So I would hesitate to make any like hard and fast rule like that, but it just warrants more conversation.
And from a regional manager perspective, I don't think that people don't know this about me, but I have a tendency to, if that's what it is, if that's what they're calling in and that's what they're saying, then I'm meeting them where they're at and leaving it as DV, whether that's anonymous or not, if they're public. I think what gets confusing for people who are using the system is that they aren't necessarily aware that just because a DV acronym is tagged to this name in some fashion, whether they're anonymous or public, doesn't mean they can only be served by VSPs. And so even if we have maybe a potential assumption that this person isn't fleeing DV, it doesn't really matter because we might have other providers who are able to offer rapid rehousing to that individual that isn't a domestic violence survivor, provider. So there's options for people. I don't remove DV from anyone's name.
Thanks, Jackie.
Mhm.
Julie had asked and Maria had shared a resource, but for those our other speakers who may not be looking at the chat specifically, are there any online resources that can be helpful for continual education or book suggestions? It is beach season, so any suggested beach reading materials to help kind of people move forward in their own kind of personal and professional journey
So I could reach
in
on
working
my-
with DV survivors.
I
Go ahead,
could reach
Tara.
on my bookshelf and get my favorite book, Domestic Violence Advocacy 2 by Jill Davies.
That is also my favorite book, and one of the reasons Tara and I are friends.
Yes.
And an incredible beach read. It'll really, I mean,
No,
can't
it's a
do anything better.
Yep, and I love it. I think it's great. It even like talks about some of the really difficult things that we have to deal with, like how do you work with a survivor on empowerment when they're choosing to still have contact with the person that abused them and things like that. So it's really helpful. It's not a long read, but it's a good read, and it's one of those ones you can always go back to in certain sections as well. I would also say the National Network to End Domestic Violence, or NNEDV, is another good resource too.
And if one of you could put the, oh, there it is. Okay, so the name of the book and the author are in the chat. Thank you. I wanted to bring up, there's been a couple references to Kayla Gower, one of our former court entry team members, but I think a lot of people on this lunch may be newer to our system. And so just to clarify, we pursued a pretty unique and incredible opportunity in, I believe, 2020 or 2019 to receive from HUD a dedicated project grant that went to Transitions of PA to create a pretty unique position of domestic violence court entry specialist. And that person is really an advocate to be a liaison between the DV provider community and the court entry system, specifically to ensure that people fleeing domestic violence are moving through the court entry system properly with the right level of prioritization and trauma-informed care and service delivery. And just last week, so Kayla Gower was the original person to staff that position, and that's Emily's reference to Kayla. But just last week, Transitions did hire our new specialist, who is at the lunch today, Jennifer Taylor, and she'll be working with Tara as her supervisor, and starting to work with the regional managers. And you should see her soon in some of the regional by nameless meetings, and she's on our court entry committee as well for the CoC. So I won't put her on the spot. She's just getting started with us, but she is with us, and that means that it's really important to have that kind of liaison as a bridge between the two systems. Perhaps a stressful job, hopefully not too stressful, but a very important one.
Thanks for the introduction, Jason. And yeah, it's great to see everyone's faces. I've been hearing a lot of names, so it's nice to be able to tie those together. And I'm looking forward to working with everyone and hopefully finding ways to bridge some of the gaps that we're talking about today.
Great, thank you. So we're moving towards the end of our lunch. There are no other questions in the chat, but it's certainly not too late to ask one, or if anyone wants to just unmute and ask a question. But are there any, as we move towards the end of our lunch, and I'm wondering if our presenters have any other words of wisdom or insight that you wanted to share with us? And I'll just say, if you're thinking about that, or a final question, we are vigilant in continuing to think of ways, or smart ways, to really make our court entry system as effective and efficient as possible for everyone, including people that are fleeing domestic violence. So we're continuing to look at ways that our policies and procedures, as well as how our HMIS data system functions, to really make sure that we're connecting everyone in a safe way, as efficiently and effectively as possible, to the resources they need to end their experience of homelessness, and do so in a safe way. And So our work is continuing, and that means we would love to continue to hear from all of you about some of the challenges you're experiencing or some of the ideas you have about how to improve our part of the system. We do have a dedicated Slack channel. If you're a CoC member, you can find the Coordinate Entry System Slack channel and post your ideas or questions there. Approximately once every 2 weeks, we have a Zoom open office hours for Coordinate Entry, and anyone is welcome to join that. And it's not uncommon for questions to arise in those open office hours. Typically, they're Monday mornings at 8:30, which I know is not awesome, but it's actually a good time to get people together who are otherwise busy the rest of the week. And it's not uncommon to have questions there from our core entry specialists or referral partners about working with people that are fleeing DV. And if you're on our core entry mailing list, you will get invited to those open office hours. And if you're not, I'm going to put my email in the chat for the purpose of signing you up for that if you're interested. So any final questions or thoughts for anyone as we kind of come to a close here? All right, well, this has been fantastic. I hope it was a good, I didn't see enough lunch being eaten, but I didn't help model that. But I'm really excited that we're at least able to connect virtually. This will not be our last brown bag lunch series. We'll probably be featuring some other topic speakers and challenge areas, but really appreciate that you all took your time to be with us. And if you could just join me in thanking our 4 presenters today. They were incredible, and I'm just so privileged to work with all of them. So virtual round of applause, and really appreciate it. And we will make this recording available for everyone that could not attend today, but thank you again for all of your time, and have a good afternoon.
Thank you so much.